You may be suffering from a potentially serious health condition, but you may be unaware of it because it doesn't give signs and symptoms in early stages of the disease. This condition can affect your liver. It can cause liver inflammation, liver fibrosis, liver cirrhosis, and even hepatocellular carcinoma, that means liver cell cancer. This condition is commonly known as fatty liver disease of the liver, which many of us get to know when we do an ultrasound scan of the abdomen. This condition was earlier called NASH, non-alcoholic steatohepatitis. Now it is called MASH, metabolic dysfunction associated steatohepatitis. Earlier we thought that this condition was mainly due to excess ingestion of fat, but now we know it is a more complicated process. It's not only ingestion of fat, it is mainly due to ingestion of lot of carbohydrates, sweets, and lack of physical exercise, other genetic factors. It is a metabolic dysfunction in the body. So most people, when you are diagnosed with a simple fatty liver disease, it does not mean that everybody goes into this fatty liver condition which leads to cirrhosis of the liver. Only potentially few people leads into this condition. But why take a chance? Because this condition is totally preventable and curable from lifestyle modification. So we will go a little deep into the disease. We see what happens inside our body. When we ingest food, our food is absorbed into the eccentric vein, which is later connected to the portal vein, and the blood is taken into the liver. So after we ingest, the nutrients are first taken into the liver. So our food is metabolized and processed in the liver before it reaches the other organs. So what happens is when we have excess amount of carbohydrates pumping into the liver, it is converted in the liver to fat and deposited as fat in the liver cells. This fat is toxic to the liver cells and can cause liver inflammation and can cause liver cirrhosis. So how could we prevent getting this condition, or how could we cure this condition? Because it is estimated about 30% of the world population may be suffering from fatty liver disease, which would potentially lead to cirrhosis. So if you follow the few steps I'm going to explain now, you can definitely overcome this condition. Number one step is to cut down on all sugars or stop eating any sweet substance where sugar has been added. If anything is sweet to your mouth, don't take that. But there is an exception. You can take fruits, but when you take fruit, you must take it as the whole fruit, not as the processed food or the fruit juice. Other important step is to cut down on most of high carbohydrate food like rice, bread, cakes, shorties, or anything which contains high amount of carbohydrate. But you can take any amount of vegetables, though vegetables also have carbohydrates. It mostly have cellulose, which is not digested and which reduces the glycemic index of food and the caloric density. So you can take any amount of vegetables, also fish and meat and eggs. So your diet should be mainly consist of vegetables, meat, fish and eggs. The other most important step is the physical activity. The physical activity is the only thing that could take the fat out of the liver. Now, when we do exercise, mostly the energy comes from the glucose in our body and the fat which is deposited in our adipose tissues and the liver. When we start walking or doing exercise, first we mainly utilize the glucose which is there in the blood and glycogen which is stored in the liver. But within about half an hour or so, most of our glycogen and the glucose store is over, and then only our body start burning the fat deposition of liver and adipose tissue. So the best advice how we could do a physical activity or exercise is to start doing exercise when you are in the fasting state. That means early morning is very good because you have already fasted for at least 12 hours. So don't take any food which contain energy. Just take a glass of water and go for a brisk walk non-stop for about 1 hour. Because it's very important to go when you're fasting, because our glucose storage is very much low. So our energy has to come from the fat which is there in our adipose tissue and liver. So gradually the fat comes out of the liver and you can get cured of the fatty liver disease. Another important thing that you have to practice is intermittent fasting. That means you have to stop eating for about 16 hours. That means you don't eat anything for 16 hours. You completely fast for 16 hours. The best practice which you can do is have your dinner at about 7 o'clock in the night and then skip breakfast and have lunch. So during this period you can't take anything which gives you energy, but you can take any liquids like water, green tea, coffee or anything that does not give you energy. So if you practice these few habits which I have explained to you, you can definitely get cured from your fatty liver disease, and also it's a preventive measure which can prevent you getting into this. Not only that, if you follow the steps which I have given you, it will reduce your weight and also will make you look younger and prettier.